Just now we will do some sutured maneuvers for connection of the wound presenting on our external layer, which will be skin. With the help of it, we are using first of all such instrument. It will be first of all needle holder, insert, and if we are necessary to have the needles. If we are having a specific needles, it was not necessary to do any more maneuvers like positioning of the needle comfortably and right in the area of the needle holder. It must be positioned as a partially and pressed in the area when 2/3 of the needle will be for puncture and 1/3 will be for connection with the needle. Carefully compressing. Other obligatory maneuver was positioning of the needle in the tip of the needle holder. It must be just nearby tip of the holder. We will perform a simple nodular suture, which will be look like the next. With the help of our needle, we are connecting both parts of the skin by such protrusion of the needle through both parts of the skin nearby wound. Trying to introduce needle till we achieve enough part of the needle from the opposite side. Then keeping it by the needle holder by semicircular maneuver, we are removing it from the skin and producing till not large part of the remaining thread. 1, 2. Perform a suture we can perform by our hands, and it will be manual or ductile method when we are keeping two parts of the thread on one of our fingers, performing tying of the wound with putting in the nodulus on each one of the sides. For another method of doing the performing of the tying of the threads, it can be using only instruments, and it will be upper ductile method of tying. For this purpose, we are using at least 2 instruments with what we are performing the next activities. Rounding the long thread onto the needle holder, keeping it by clamp. In such a moment, we are taking the remaining part of the short needle from the opposite side and performing the nodulus as previously on one of these areas. Doing it as the necessary second variant of it position. Besides simple nodular suture of the wound, can be very actually for achieving more cosmetic variant of the wound connection using of such suture, which is titling as mattress-like Donati-Macmillan suture, the sense of in which we are doing positioning of the thread on 2 levels of the wound. Beginning the suture, it is looking like performing a simple variant. We are introducing the needle from this approximately in 1/2 or a half a centimeter of the border of the wound and cutting it till the bottom. Exactly such we are coming out from the skin in the opposite side of the wound, producing the rather enough part of the needle, and then similar activities you are doing and removing the thread till practically the end. Just now we're not performing any suture, we are putting on the next level. In this case, we are performing practically intraductal, intraskin suture in the area of one side of the skin and the next side of the skin, and doing the same activities with removing of it out. And just now, when we will perform a suture, we are not necessary to have any assistant for connection, as it was previously, by the way, will be necessary to use of our both parts of the skin wound for careful connection of each borders. We can perform it by ourselves. When our one part is doing this, we can connect the wound with two-level suture, carefully doing the nodular performing with the manual or apodactyl as well method.